When Maria first began her NCLEX journey, she felt exactly the way so many beginners feel: overwhelmed, confused, unsure of where to start, and silently terrified that the exam might be harder than she could ever handle. She watched classmates pass while pretending they didn't read anything. She saw others fail and disappear quietly. And in the middle of all that noise, she kept asking herself one question: am I truly capable of passing this exam on my first attempt? Back then, Maria believed the NCLEX was about memorizing hundreds of diseases, cramming drug names, and reading as many random notes as possible. She thought that if she collected enough PDFs and watched enough videos, the exam would reward her effort. But her reality was very different. Every time she opened a page or question bank, she couldn't see the connection between one topic and another. Nothing seemed organized. Nothing made sense. Everything felt scattered. And she believed something was wrong with her. That was the then version of Maria, the version relying on anxiety, guesswork, and fear. What she didn't know was that the NCLEX is not built to reward memorization. It is designed to evaluate something far more important: her ability to think, prioritize, and act like a safe entry-level nurse. The exam wasn't asking whether she remembered the symptoms of a disease. It was asking whether she could recognize danger. It wasn't asking whether she knew the definition of a medication. It was asking whether she could keep a patient alive. And this realization is where everything changed. Maria began to understand that the NCLEX examines 15 must-tested categories that every nurse must master: physiological adaptation, reduction of risk potential, health promotion, basic care and comfort, safety and infection control, psychosocial integrity, pharmacological and parenteral therapies, management of care, and the 6 stages of clinical decision-making: recognizing cues, analyzing them, prioritizing hypotheses, generating solutions, taking actions, and evaluating outcomes, all together forming clinical judgment. These weren't random lists. They were the actual blueprint for thinking like a safe nurse. The beginners who never learn this blueprint remain stuck and frustrated. But the moment Maria discovered it, a transformation began. She began to see why she struggled before. She had been reading words without understanding what the NCLEX truly needed from her. She used to memorize information without context. She knew diseases but couldn't connect them to patient safety. She knew medications but didn't understand their monitoring. She knew values but didn't know which abnormalities were true emergencies. That was the old version of her, relying on scattered knowledge. The new version of Maria approached the NCLEX with strategy. Instead of reading everything randomly, she grouped her preparation according to the 15 categories. She understood that physiological adaptation meant knowing how each body system responds to disease and stress. She realized that reduction of risk potential meant preventing complications before they arise. She saw that safety and infection control were woven into almost every question. And she finally accepted that the NCLEX would only pass her if she consistently demonstrated safe thinking across every single category, not just some. She began her study journey by learning to recognize cues, not just vital signs, but subtle dangers like restlessness, confusion, abnormal labs, and sudden changes in breathing. She trained her brain to analyze these cues and understand what they meant for the patient. She practiced prioritizing problems using the ABCs, Maslow's hierarchy, risk reduction, and safety principles. She became skilled at generating solutions, taking the necessary nursing actions, and evaluating whether the interventions were truly working. Slowly, her mind shifted from memorization to application, from confusion to clarity. She also learned something important. The NCLEX is not looking for perfection. It is looking for safe, consistent decision-making. A beginner who understands safety can outperform a memorization expert who doesn't understand priorities. Once she allowed herself to learn safety first Everything else began to align naturally. Maria became intentional. She began practicing with NCLEX-style questions that mirrored real clinical scenarios. She stopped running from difficult questions and instead asked herself, what is the safest action here? Every question she solved helped her think more like a nurse. She learned red flags that all beginners must know: sudden chest pain, difficulty breathing, decreasing level of consciousness, signs of infection, low blood glucose, uncontrolled bleeding, new neurological changes, and unstable vital signs. She understood that these emergencies must always come first because safety is non-negotiable. She learned that medications were never meant to be memorized as isolated names. They are understood through their classes, effects, major side effects, and required monitoring. Suddenly, pharmacology became logic, not stress. She learned that patient education and health promotion was not about reciting facts, but about communication and clarity. She learned that psychosocial integrity meant supporting mental health without losing boundaries. She learned that management of care meant delegating safely and protecting vulnerable patients. The more she learned, the more confident she became. And for the first time, Maria saw that the NCLEX was not designed to intimidate her. It was designed to protect future patients and to pass her once she could think safely. On the day she took her exam, she opened the computer aware of something powerful. She wasn't the confused beginner she once was. She had transformed. She could recognize cues. She could analyze them. She could prioritize correctly. She could act safely. She could think like a nurse. When her exam shut off, she didn't panic. She smiled because she knew she had finally become the now version of herself. Days later, her results confirmed what she already knew. She passed above passing standard across every category. Her story is proof that anyone, no matter how overwhelmed or underprepared they feel at the beginning, can pass the NCLEX on the first attempt with the right guidance, the right structure, and the right mindset. You do not need to be perfect. You only need to learn how to think like a safe nurse. And if you are watching this right now, your own transformation has already begun. You are capable. You are ready. You can do this. And with the right strategy, your NCLEX success is not just possible, it is inevitable. So if you're just beginning your NCLEX journey, let this be your reminder that confusion is normal, overwhelm is normal, and even fear is normal, but staying there is optional. What matters now is that you build the right foundation, use the right strategies, and train your mind to think like a safe nurse. You don't have to figure this out alone. I'll be creating more clear, structured, beginner-friendly NCLEX videos that will guide you step by step through every category, every skill, and every level of clinical judgment you need. Watch out for the next videos, take your preparation seriously, and stay committed. Your NCLEX success story has already started. Just keep going, and you'll get there sooner than you think. If this story motivated you, subscribe to Nurse Chioma TV, like this video, and comment, "I will pass," because you will.